So there was a very busy ASH with a lot of new data being communicated, and also continuation of the data from clinical trials that are maturing right now. And it's actually very important to see long-term and follow-up data on those trials. There are a few really busy days, but I picked a few of the clinical trial results that were communicated. Some of them are included in the plenary that are considered to have practice-changing potential. And one is in CLL, one is in follicular lymphoma, and the other one is in AML. So I will start with CLL 17, which is a phase 3 investigator-initiated study, global study that enrolled a very significant number of CLL first-line patients, over 900 untreated CLL patients, and they were randomized 1:1:1. So the point here was to compare continuous dosing of BTK inhibitors, which is standard of care, with fixed duration of a combination regimen between the BCL2 inhibitor, which is venetoclax, combined with anti-CD20 monoclonal antibody or BTK inhibition. And the fixed duration was basically 2 months of the two combination therapies. And the results were actually very significant and very important for the treatment of these patients. It's first-line CLL, and the fixed duration venetoclax doublets were actually non-inferior to the continuous ibrutinib dosing. So, and the 3-year progression-free survival for all the across all arms was actually very good, over 80%. And the hazard ratios for venetoclax, obinutuzumab, and the venetoclax ibrutinib combinations were actually met the non-inferiority criteria, which is basically the primary endpoint of the study. The depth of response were better in the combination arms. The venetoclax obinutuzumab achieved the deepest MRD negativity, both in blood and in bone marrow. And venetoclax ibrutinib showed very good efficacy, but it had a slightly different safety profile, having a little more BTK inhibition-related adverse events, especially cardiac AEs. So going further with the safety findings of these studies, as I mentioned, there were more BTK-related adverse events with continuous ibrutinib, but the time-limited venetoclax regimens actually allowed for free interval treatments, which is important for the quality of life of the patients, and also reduced the cumulative toxicities, which I thought it obviously makes it a potential practice-changing results of these two combinations. The results were met with a lot of enthusiasm in the community.